Welcome back. You're watching Morning Express. Thank you for staying with us. So let's take a look at the latest state of the economy. And we want to begin down in the coast, where just yesterday the county government sort of gave the way forward in terms of sticking to the COVID-19 guidelines. And after this, the hospitality industry seems to have recorded losses running into millions of shillings following the Ministry of Health's ban on gatherings, which sort of led to corporates cancelling events. So let's take a look at this, where the health and the economy of the country are sort of interlinked. Here's that story.
In the last 1 month, the county of Mombasa has witnessed a surge in the number of new COVID-19 infections, with fatalities doubling.
The positivity rate across the county grew from 7.1% in the month of June to 15% in the month of July. The mortality increased from 36 in the month of June to 89 in the month of July.
Now, the county's Coronavirus Disaster Management Committee is moving to try and contain the surge. The treatment of COVID-19 patients at home has been banned.
We have received cases whereby some individuals have opened ICUs in their own homes. That is a very dangerous practice.
The committee has also banned public meetings and entertainment in social places.
Live bans from hotel, from a bar, is banned forthwith.
Mombasa County imposed the measures as the national positivity rate rose from 12.5% on Monday to 15.4%. Out of a sample size of just over 7,000, 1,085 people tested positive for COVID-19, increasing the number of total confirmed cases in the country to 205,356. The number of cumulative fatalities stands at 3,995. By yesterday, just over 1,734,000 vaccines had been administered across the country. Of this, 1,067,615 people have received their first dose and 666,398 the second dose. On the international scene, a new COVID-19 variant believed to have originated in Colombia is now spreading in the US, with cases recorded in South Florida. Rita Tinina, KTN News.
Okay, so that's the latest in terms of the restrictions due to the COVID-19 right now. The coast is sort of also giving the way forward in terms of enforcing the COVID-19 protocol. Still with me, Martin Zowino, Bunyasi Sako, and Stephen Mwakesi. Mwakesi, I would like to start with you on this particular matter. The hotel industry might record losses running into millions or billions of shillings, but of key importance right now is the vaccination drive, even as we talk about some of the restrictions. What say you about the fight against COVID-19? Give us a status report from where you sit. Are we heading in the right direction? We've seen the numbers, 1.73 million so far have been vaccinated, less than 3% of the population.
Yes, you know, when I look at this, Jesse, I think when it comes to vaccination, we are still doing extremely poorly. And vaccination, as has been shown by data, or even what's happening in the US right now, is still not even the most foolproof mechanism that we have against COVID-19. Because you'll find even in the US, with this Delta strain, people who are fully vaccinated are the ones who are contracting COVID even higher than in states where there's very little vaccination. So I still believe what we do need to follow through on is the ensuring that we enforce the directives that has been put forward. There's a lot of laxity when you go into most of these hotel-based industries, I mean like hotels, pubs and restaurants, about following the guidelines that have been put forward by the Ministry of Health. And I think because it's a hospitality industry, I think most of these owners and proprietors are having a hard time getting their patrons to actually, you know, keep social distance and you know, adhere to the protocols that have been set by the Ministry of Health. For me, what I would really try and recommend going forward is that the Ministry of Health would need to really look at having public health volunteers who can be able to be stationed in some of these spaces so that we ensure that we follow through with these directives, because we're not doing enough. And for me, if we continue at this particular rate, some of these hotels will end up being shut down now for real, because I think right now the only restriction that was put in the last advisory was on the issue of political gatherings. So to try and keep the industry going for the time being. But at the rate at which you're going and the high numbers of positivity rates that we're seeing right now, it would be very imperative that for the hospitality industry, they need to take additional measures to ensure that this thing is done. I also want to congratulate Najib Balala yesterday for urging that people in the hotel industry are considered as frontline workers, and at least they get vaccinated before everyone else going forward. So these are some of the positive measures that I'm seeing. About recovery for the sector, the hospitality sector, there was some money that was done in the last financial year, part of the economic recovery strategy. I still believe there's a lot more that can also be given as stimulus to much of these hotel-based entities, so that at least they can be able to be propped up, because that recovery has not come to the level that we were really hoping. And so it's important that we also continue inducing a stimulus to the hospitality industry so that it can be propped up well going forward.
Okay, Martins, you sit in the health committee, and we're talking at a time where carefree attitude seems to be the order of the day. Everyone knows what to do, but they're simply not doing it. So as we talk about this, perhaps add your voice to the politicians who might also know what to do, but they're not doing it in terms of political gatherings. Time and time again, the Ministry of Health might necessitate the fact that political gatherings are banned, but we well know of the movements of some of these politicians. I don't know if you fall in this category, sir.
Not quite, because of my professional, but standing. Now, Rogers, there are two ways of fighting this disease. One is containment, and the other one is mitigation. Mitigation is the higher end of tertiary care, where we talk of oxygen, access to bed, hospital, and all that. That part is very expensive. We cannot make it, and people will die. The only segment we have is the containment. That's why I agree with Balala. I don't know why the people in hospitality industry were not included in the vaccination priority. They should have, so that all of them are vaccinated, and then they use other protocols, the mask up, safe distancing, and all that, so that people can return to work. Those industries should be open, because if we don't, we have those other rippling effect, even to the household, loss of income and people desperate and all that. Vaccination, let me talk about that a little bit. Even though people still get infected, that's fine, but research have showed that those who get reinfected, 99% do not end up in hospitals. And they're okay. They get mild infections and manage it, and it's okay. So vaccination is number one, and I really thank the ministry. Let's be aggressive on this, get whatever we can get. But the same token is about Kenyans. Some are still skeptical. They don't want to be vaccinated, and we have vaccines sometimes expiring, or people get into desperation. What do we do? It's only a week left. So come up now. It is open for everybody. Come out and get vaccinated. The other thing which I want to say on politics, if you love people, take care of them. Rogers, the effect of Kiambaa and Juja are coming up. And you know, it has reached a state that this variant is so aggressive and very severe that people just drop and die. They don't even end up in hospitals, from the village to the morgue. So we don't even have the data. We can say this is a crude death rate. So many people are dying. I think you picked up one family where almost 12 are down. That is where we are. So to my fellow politicians, yes, we love the crowd, but we are endangering our crowd. Because this variant, which is called Delta, its transmissibility is very fast and is very severe. So once you have a rally, they don't wear masks. Why they don't wear masks, we don't even know, because people sometimes don't value health. When they live there infected, and they're going to infect their families, and we may end up like India and Brazil. So my appeal, however sweet it is to see a crowd, please, let us follow the protocols and avoid where we can. Thank you.
Okay. Sako, as you heard your voice, I don't know if I'll be targeting the One Kenya Alliance leaders, but I'm looking at the front page right now. Most of them have removed their masks, smiling for the photo ops as they hold that particular document. So perhaps necessitating the need of the leaders to maybe lead by example. How do you add to this discourse, sir?
Oh, no, just they are not being fair. If you watched the script where they're walking towards that podium,
they had the masks.
Each one of them had masks.
But they
just
removed.
At the moment of delivery, and because there was quite significant distancing between them and the other people, I think that needed to remove the masks for audibility and also for identification, I would say. Yes. But let me, on this particular issue, I want to agree with my colleagues fully, but I just want to add the fact that initially we targeted certain frontline workers because they would be the one, we need them safe for everybody else to support others. We need our doctors alive and nurses to support us all in this crisis. However, I think now we have reached a point where the ordinary citizen, the owners of this republic, the Mamambogas and the Wanjikus and so on, must get into the equation. I think what has not worked out clearly, and I can use my specific example of Busia, in case there are differences across the country that I'm not aware of, is that the ordinary citizen has no access to the vaccine, does not know the plan for the vaccine. It's not being made open enough in these localities for the ordinary people also to participate into it. And there will be some, and there are many, who would be reluctant to take it. But there are many who are willing. I've received that question, yes, but if I want the vaccine, where shall I get it from? Do I pay anything to it? And so I think let's get this information down to the people. Lastly, the hotel industry is in a difficult position because they have their workers. If you have 100 workers, you have 100 points at which you can bring in the disease into the hotel. Your workers can take all the precautions, but they go back there and they interact with their own families and with others, and their families interact with others. So it's only when there is a generalized community vaccination that, in fact, the hotel industry will begin to cope better. Others, we're putting too much of a responsibility on their heads.
Okay. Gentlemen, let's shift focus to economic recovery right now. And Mwakesi, the talk of town right now is all to do with the theories. I don't know if they're practical yet, but we'll get to see, especially with the promises politicians hand on the podiums. But add your voice to this. Kenyans are reeling from the tough times. Hence, the message seems even more practical, even more alluring. So from where you sit, we have the bottom-up approach. Of course, Raila Odinga has been quite vocal with his vision for the country. We have the One Kenya Alliance, the likes of Musalia Mudavadi, fronting an end to corruption and managing resources prudently. What say you about this current economic discourse?
Jesse, I think last week we also discussed the same thing, but I'll just try and put it in this context. Right now, I think the focus, and for all the monies that we are intending to get from the IMF and World Bank and everyone else, the focus for anyone who's receiving money in terms of the country and to try and really stimulate how the economy is going, they should be really looking at putting money in the small enterprises and in people's pockets. I'm still a big believer in trying to make sure that the availability of credit, especially for small business owners, is something that we keep as a priority going forward, because the difficulty that people are going through in terms of being able to prop up and keep their and sustain their businesses is one of the things that's putting Kenyans on a very flat or downward downward spiral.
Okay.
So for me, when I look at that, and of course, when you look at the generalities of some of the stopgaps that we need to put in place, like fighting corruption, making sure that every expenditure that is intended for Mwananchi actually gets to reach them, is something that we need to really focus on. My call, without looking at 2022 and anything else going forward, is that I believe Parliament and even the state generally should really relook into the issue of how we are going to utilize the affirmative funds for the period that we are looking at COVID recovery. I think that is also a key tool that we can utilize over this particular point to try and make sure that from the bottom up, as it's literally being said, because affirmative funds are targeted at people who would naturally not be able to get into a financial system and be able to acquire loans and keep their businesses going, are actually focused on, and we make sure that we make it easier for Kenyans to really access these monies to be able to survive this COVID period. So for me, that's my rallying call. When it comes to politics, I mean, there is no discussion for me. When I look at it, anybody who's going to fix the economy going forward really has to target how they really touch the lower cadres of our economy strata. And for me, if you focus your programs around that, Raila is trying to do that with his rural inclusion ideology. William Ruto has done the same in terms of creating, working it out from an economic theory perspective of bottom-up. And anybody who really wants to genuinely talk to Kenyans would have to look at how they're going to pump in and inject new life into that lower strata and make sure that the SME businesses, the Juakali sector, the mamambogas, the farmers are really rejuvenated in terms of how they access funds for their personal and business growth.
Okay, well noted. Martins, I mean, the talk in town is that bottom-up approach is not tenable. It's just theory. It may not be practical, at least according to those who share your school of thought. And there are others who might argue that, you know, rural-urban integration is a piped dream. So how do Kenyans make sense of all this lingo that is currently on the political podiums, even as we try and put more money in our pockets, sir?
Thank you, Rogers. First of all, let us do away with the theories and remain with practical. There's nothing like bottom-up. All bottoms are down. And you're not telling us how to get them up. It's a twisted theory which is designed to reign over people's emotions and frustrations. Kenya has one of the best blueprints in economy, especially access to resources for the vulnerable and rural folks. I would just encourage, like in my constituency, I have 40 million to give to the young people under youth enterprise. I've given 20 is remaining. I would encourage youth. You only have to be 5 in number, register, and access 100,000, which you can pay in 6 months and go for another loan of 200,000. These are already there. The women enterprise, the rural electrification, which my party leader started, we call it last mile. I'm now almost at 60% in my constituency. I want the government to put more money so people can have light industries. The infrastructure, roads and all this, they are there. So having something and putting Kenya as that it is new is not there. What I would like those who are really promoting this to tell us, Rogers, what is bottom-up in your language? What is bottom-up in Swahili? In Luo, I cannot even say it. Why are they hiding in English? Let them promote it in vernacular so that we can hear what they are saying, talking about. But in economy, there's nothing like bottom-up. Those which were tried by countries like Israel, there were money from the top invested at the local level, industry set up, water system, and everything. You cannot talk of bottom when you have 2 billion being stolen every day. So to us in ODM, the first animal to slay is corruption, so that we can have money to invest in rural setting.
Okay.
And link the rural to the urban areas. who are also vulnerable in other quarters. That is the way to go, and it is not just what my party leader is saying. It's what he has done and is going to continue doing and doing effectively for everyone who is in this country.
Okay. Sakwa Bunyasi, I mean, I don't know if you hold the same thought. Okay.
I want, if you allow me in a very short space of time, I want to have two parts to my comment on this.
All right.
Let me first just speak as somebody in the economic profession, but many other people may have similar views and even deeper understanding than I might have. Then I'll also talk as a politician for a minute. Kenya is a very unequal country. This has been studied forever, as it were. And it's the consequence of the development pattern that we may have pursued right from the colonial period. At one time, in terms of, there's a measure, it's called a Gini coefficient, which measures the level of inequality. Essentially, it says what proportion, what percentage owns, what percentage of the population owns what percentage of the wealth. And then you'll find that probably 1% owns as much wealth as 80% of the population. And therefore, that inequality is a real problem. How you tackle it is the issue. When they say bottoms up or trickle down, which is the one on the other side, there are two competing schools of thought that you can actually get down to the grassroots, the poverty, where the poverty bites hardest, by developing, investing in the economy and having those benefits trickle down to everybody down to the grassroots, and by everybody is every member of the population. Others who say you can have an aggressive transformation at the grassroots level where the households are empowered increasingly to invest in what they can in their own localities and build it up again, be it with the corporate world somewhere along the line. Now, I can't go into which countries have had which experience, but there are experiences on both sides of this equation. Now, when what my colleague has described, which is, I think, a very good thing he's doing in Diwa, down to put resources in the hands of the people, you can say, if that category of the people is dealing with, like the youth and any other, the women and any others in our typical rural areas who are actually receiving these resources, you are doing what the bottoms-up people would be asking you to do. And I think what is lacking here is that for too long, we Kenyans have really not nothing to do with this politics of today.
Okay.
We have praised the quantum of investment, the magnitude of investment. We have not measured, or we do measure, but not adequately, the proportion of people we are uplifting from poverty. We know countries that have uplifted significant populations from down, including China, which had a very strong bottoms-up approach, but which also had a trickle-down combination to globalize its economy, to cooperatize their operations and so on, so that that corporate entity and that grassroots capacity of capacity building, enterprise, entrepreneurship development and so on, be somewhere along the line. The worst-case scenario is for us Kenyans to deny that we have hardcore poverty out there, and it's growing, we are not lifting it, because people will laugh at us, and they don't need to be to school see it every day.
Okay.
And it's being confused a bit with the politics now, but every party, the agenda that was, for example, aligned by ODM is fine. What would need to be important now is their own analysis to say, but if we did this, how many people would we lift out of poverty in our 5-year term or in a lifetime? And all parties should do that. When Musalia talks about the challenges in the macroeconomy, what he's saying, shake it loose, create headroom, then you can be able to invest in ways that will reach the poor. So in many ways, we are saying the same thing, but we are not doing too well about it. Now, I want the political side, and very briefly, is that Kenyans must fully appreciate the depth of suffering of the poor. And in all of their manifestos as we go forward, whatever they have proposed, forget the words bottom up and trickle down. Just tell people in plain English or plain Swahili or in plain Luo or Dholuo, as my colleague has alluded, what it is you'll do that will make a difference for them to be able to put food on the table, but not have that compete with uniform in school. That will be able to get them to go to the health center, not have that compete with whatever else you want to do. these trade-offs have become too basic in survival. It's our challenge, all of us, irrespective of which models we're discussing, to demonstrate finally, not that it will lift Bunyasi, who already earns this, he will get more, but that it will enable that person, poor person on the ground, to treat their broken toe and have their child go to school, but also be able to have a meal a day. That's what governments are all about. Otherwise, there's no need to have this corporate thing called a government if it doesn't focus on that. But now we have confused too closely what the narrative is by the various political parties here with the issues that we live with. And I think we should sometimes separate that.
Okay, narratives on one side, issues on the other. Let's take a short break. We'll be back with this and much more. Stay with us.